Hyo-Soo Kim and Dr. Michael Gibson coming to you live from ACC 2023, and we're talking about the HOST IDEA study comparing different durations of dual antiplatelet therapy. Talk to us a little bit about the study.
We performed for the last 4 years HOST IDEA randomized clinical trial. In this trial, we tried to compare 3-month versus 12-month DAPT after PCI using contemporary drug-eluting stents with ultra-thin strut and advanced polymer technology.
And this is a randomized comparison of 3 versus 12 months?
Yes.
And what did you find?
Yeah, the background of this study is a kind of guideline. Recommend DAPT 6 months in case of stable disease and 12 months in ACS. But now we have third generation DES with ultra-thin struts and advanced polymer technology that may have theoretical benefits that minimize the risk of stent-related complications, but limit data available on short-term DAPT after PCI using third generation DES. That's the reason why we started this HOST IDEA RCT. What's the third generation DES? Now we focus on Osiro and Coroflex Izar because they have really ultra-thin strut thickness. In case of Osiro, 60 micron in small size and 80 micron in bigger stents. Coroflex Izar was thinner, about 50 micron in small size and 60 micron in bigger size. Both systems adopted the unique drug delivery system, basically bioresorbable polymer, or in case of Izar, they adopt polymer-free protocol-based bioresorbable drug matrix. There's such kind of third generation DS should be adequately studied in terms of DAPT duration.
And who were the patients that you enrolled? Were they post-ACS or stable patients?
We enrolled all-comer patients who received PCI using two kinds of third generation DES.
And when you say DAPT, was it clopidogrel or prasugrel or ticagrelor? What kind of thienopyridine was used?
Yeah, about 90% of DAPT was aspirin plus clopidogrel. That is actual practice pattern in South Korea, because we know clopidogrel may be better than stronger agents such as ticagrelor or prasugrel in terms of bleeding issue, but also in terms of thrombotic issue. Thus, most doctors in South Korea prefer aspirin plus clopidogrel DAPT. Thus, in this study, about 90% of patients were treated with aspirin plus clopidogrel.
And what did you find?
We enrolled, we randomized more than 2,000 patients into either 3-month DAPT or 12-month DAPT. And the primary endpoint was NACE, cardiac death, target vessel MI, TLR, and stent thrombosis, and major bleeding, BARC type 3 and 5 at 1 year. That was about 4% in both arms, 12-month DAPT as well as 3-month DAPT. When we perform a landmark analysis around 3 months, there is no difference before landmark, after landmark between two arms. We also checked the secondary endpoint, target lesion failure or major bleeding. Target lesion failure was around 2.5% in both groups. Major bleeding instance was also not so different, 1.9% in 12 months versus 1.5% in 3 months. Numerically, it's a little bit lower in short DAPT, but that did not reach statistical significance.
How about the ischemic endpoints, death, MI, stroke, the kinds of ischemic endpoints we worry about? Did those differ between the two groups?
No difference. Target lesion failure is about 2.5% in both groups. That is composite of cardiac death, target vessel MI, clinical driven TLR. Thus, in the 1 year interval, 3-month DAPT versus 12-month DAPT was compatible, suggesting we can shorten DAPT duration up to 3 months when we use such kind of third generation DES in all comer.
In all comers.
Yeah.
And after you stopped DAPT, did they get aspirin monotherapy or clopidogrel monotherapy?
About 60% of patients received aspirin monotherapy, whereas 40% received clopidogrel monotherapy.
And were there any differences? I know it's not randomized, but were there any differences in outcomes between those two?
Yeah, no difference between two monotherapy, aspirin versus clopidogrel monotherapy, because sample size is once again shrinked down to about 1,000 patients in 3-month DAPT. That was separated by aspirin versus clopidogrel, just 60% versus 40%. Thus, sample size is not large enough, but numerically it is not so different between aspirin versus clopidogrel monotherapy.
Well, thank you for sharing. Thanks for these exciting results. It adds to the literature that shorter may be just as good as longer DAPT, irrespective of the syndrome. Thanks for joining us, and thanks to all of you for listening in today.
Thanks very much for having me.